The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, my name is Nick Fusick with Child Care Aware of America. Today I'm going to be bringing you another webinar, Lunch and Learn webinar in our series about the proposed rule from the Department of Health and Human Services. Today's webinar will be about consumer education. So as you're going through the webinar, if you have any questions, please feel free to type them in the question box, and I'll try to make sure we reserve some time to go over them at the end of the webinar. So let's start off with a little background, like we always like to. The Child Care and Development Block Grant is a $5 billion block grant program that provides funding to states and territories and tribes. It is the primary federal funding source devoted to providing access to child care services and improving the quality of child care. It was first authorized in 1990, and it was last reauthorized in 1996. And the last time it was modified in any way was in 1998 when the Department of Health and Human Services put out a final rule. So let's talk a little bit about the proposed rule we have in 2013. The Department of Health and Human Services released the rule in May of 2013. It is part of the administration's plan for early education, which also includes the Preschool for All initiative, Early Head Start and Child Care partnerships, and a large piece of home visiting component. The full proposed rule will be available at the URL you can see here, and we will provide a link to the slide so that you can make sure you have all of these links and don't have to go searching for them. And lastly, the rule is open for 75 days for public comment. So if there's something that reaches out to you that you feel you need to go and make sure your voice is heard, please feel free to go and comment. The Department of Health and Human Services is looking for input from everyone on ways they can either be more clear or ways they can improve the proposed rule moving forward. So before we go any farther with this current rule, let's talk a little bit about the federal rulemaking process. So a federal agency looks to see if there's a need that can be met through the regulatory process, and if they determine there is a need, a rule is drafted. While they're drafting this rule, they consider input from stakeholders with different groups, anybody who may be impacted, and they'll typically meet with them. Occasionally they'll hold hearings or do a lot of background research prior to drafting a rule. The next step is the federal agency then publishes the rule to the Federal Register. Once the rule is published, the public is then able to comment on the rule for a set period of time, typically ranging from 30 days to 90 days. Like I said, in this case, it's 75 days. Once the comment period ends, the federal agency then reviews the comments and revises the rule where necessary. So if the Department of Health and Human Services were to see a specific section that is particularly controversial or troublesome, or that they've received a lot of comments that they need more clarity on, they will go through and revise. They have the option to go through and revise the rule to make sure it's impacting the way they would want it to impact. After they revise the rule, if they revise the rule, they then publish the revised final rule in the Federal Register. They then submit the final rule to Congress and the Government Accountability Office for review, which could take up to 60 days. And if there's no major obstacles in either of those, the federal agency then implements the final rules. So let's get back to a little bit about what's in this rule. Before we dive into the consumer education piece, let's kind of look at it, what's included. Some of the highlights of this proposed rule include requiring providers to undergo comprehensive background checks, including federal and state fingerprints, and checks of the sex offender registry and the child abuse registries. Minimum training requirements like safe sleep practices and first aid, practices to prevent shaken baby syndrome and emergency evacuation or shelter-in-place planning, planning for disaster and emergency responses in child care settings, raising the eligibility period to 12 months, helping to ensure continuity of care for children and families, and lastly, enhanced resources to assist families in finding quality child care in their area, including consumer education websites with comparable quality indicator, a consumer complaint hotline, and better coordination with other services impacting families and children. So let's briefly take a look at what are the current requirements for consumer education under CCDBG. The Child Care and Development Block Grant under current law does not have any minimum consumer education requirements. The law only requires that child care providers allow parents unlimited access to their children during the normal hours of operation and whenever children are in the care of such providers, and that states maintain a record of substantiated parental complaints and make information regarding such parental complaints available to the public on request. Parents, as consumer of child care, have a tough job. State child care laws, regulations, policy, terms, such as care that is licensed, regulated, registered, certified, or listed, are difficult for experts in the field to understand, let alone parents to attempt to decipher. State child care policies vary greatly, and state oversight of these policies is weak in most states. There are many different types of child care settings: licensed, unlicensed, center-based, home-based, care sponsored by religious institutions, care-based in nonprofit community centers or for-profit chains, etc. Unlike when parents go to the grocery store and select meat or vegetables where they know that some entity has screened the quality of the products that they choose to purchase, there's no similar quality control for child care. So when looking at this, HHS saw that there is a need to help parents and families looking for child care to be better informed, to make sure that they have all of the information in front of them and can make an informed decision about, where they're going to leave their child in the care of somebody else. So let's look at what are some of the main improvements in the new proposed rule from HHS. There's 4 main consumer education pieces. One is the implementation or designation of a consumer education website, the designation or implementation of a transparent system of quality indicators, providing parents with a consumer statement for receiving the child care and development funding, and lastly, a rationale and description of care exempt from licensing standards and state CCDF plans. So just going over them briefly, and I'll go into more detail on each one. A website with provider-specific information about health and safety, licensing requirements, date of last inspections, licensing violations, and compliance accounts taken. This would help parents be able to make it easy to find information about child care. The second one is a transparent system of quality indicators. This proposed change would require states to establish a system of indicators which would include provider-specific information about the quality of care, what standards are used to assess the quality of child care providers, teaching staff qualifications or competencies, learning environment and curricula or activities. And the third one is a consumer statement for parents, which would provide them with all the information in an easy to understand format. And lastly, a rationale and description of care exempt from licensing standards in the state CCDF plan. So states would now have to, as part of their plans, describe what providers are exempt and the reasons behind it. So let's look a little deeper at what the proposed rule says about each of these aspects. The proposed rule would add language to their regulations requiring lead or state agencies to collect and disseminate through a user-friendly, easy-to-understand website and other means identified by the agency consumer education information that will promote informed child care choices. This would include provider-specific information about health and safety, licensing or regulatory requirements, met by the provider, including the date the provider was last inspected, any history of violations of these requirements, and any compliance actions taken. Also, lead agencies would be required to include on the website a description of health and safety and licensing or regulatory requirements for child care requirements. The description must include information about the background check process for providers as well as any other individuals in the child care setting as applicable, and what offenses preclude a provider from serving children. So the goal of this is to make available a website with accessible, easy to understand basic information about how child care is regulated and monitored, as well as regulatory requirements met by individual child care providers, which can help improve the transparency and greatly reduce the burden on families. Parents often lack information regarding specific requirements that individual child care providers may or may not meet. Some states and territories currently post lists of licensed providers online, but not all licensing information is available, especially the history of licensing violations or when the provider was last inspected or monitored. Limiting access to this information creates an additional burden for parents, making it difficult for them to make informed decisions about their child care, and denies parents information about providers' abilities to protect their children's health and safety. So let's look at the next part a little bit. The proposed rule would require states to collect and disseminate consumer education through a transparent system of quality indicators such as a quality rating and improvement system or other system established by the state agency, to provide parents with a way to differentiate between the quality of different child care providers in the communities using a rating or other descriptive method. They're looking for this system to include provider-specific information about the quality of child care, the standards used to assess the quality of child care, taking into account staff qualifications or competencies, learning environment, and curriculum and activities, and lastly, disseminating provider-specific quality information, if available, through that website or an alternative mechanism. So basically what this would allow parents to do is be able to figure out in a very straightforward manner how the state looks at quality in child care settings and allows them to be able to compare them across settings and across states, which is difficult for parents to do, especially if they're moving from a state with a quality rating QRS system to a state without it. The third section is for families that receive assistance under this part. The proposed rule would require that state agencies provide information to parents receiving subsidies about the child care providers available to them, as described in the previous two sections, and specific information about the child care provider they choose, including health and safety requirements met by the provider, and licensing and regulatory requirements met by the provider, and any voluntary quality standards met by the provider, and any history of violations or licensing or health and safety requirements. So currently those who receive funding from CCDF would be able to, once they decide where they plan to place their children, which child care setting, they would receive a consumer statement from the state agency that basically gives them all the information about that provider. You know, are they in compliance with state and federal standards? Are they, have they had any violations in the past? If so, what has been done about the violations in the past? And if there's anything else where they go, say, above and beyond the call of the state and federal regulations, because as we know, many providers have, you know, higher standards than even the state and federal providers, so, or state and federal requirements. So we want to make sure that the consumer education statement is making sure it's straightforward for parents to understand. And lastly, as I mentioned briefly, and I'll just talk about it briefly here, is it also requires a description and rationale of license-exempt care, which is a new change. What this means is that states in their CCDF plans, when they're putting them together, will be required to provide a description and rationale for why certain providers are exempt. There's currently not a lot of information available about why providers are exempt in certain states. Some states do voluntarily include the plan, but until recently it has not been required in state plans to provide any information on that. So what is HHS specifically looking for comments on? The Department of Health and Human Services is specifically seeking comments on what elements should be included on a consumer education website and the categories that were specified as part of a transparent system of quality indicators, and what experience have agencies had collecting and sharing provider information, including what types of information from background checks are shared with parents seeking care. So what they're asking for in the first part is, okay, so we want to have a transparent system of quality indicators. They've made suggestions as far as what they should be, and Child Care Aware of America has also made suggestions on what they should be. But what do providers, what do state and local resource and referral agencies, what does the field think about these systems? Do they have any recommendations about how it should be phrased? So if there's something there that you see, we really recommend going and commenting on it. As I said, the Department of Health and Human Services is looking for input on this. And the second part is, you know, a lot of people out there have had hands-on experiences working with consumer education, so they want to make sure they're doing it in the most straightforward way. So before I get into the questions, I want to let you know that we have some of the resources available here, some helpful links that while you're going through, you know, possibly looking to comment, these resources would be helpful for consumer education. As I mentioned before, these slides will be provided online on the Public Policy Lunch and Learn webinar page, where you can register for webinars. And some of the stuff you'll find here is just information about parent engagement as part of consumer education, a white paper we wrote about parent services, the information from the Administration on Children and Families on the role, a link to comment on the role, a link to find some sample comments. So a lot of people haven't been through the federal commenting process before. It's new to a lot of people in D.C. and it's new to a lot of people out in the field, especially in the States. If you have any questions about commenting, this guide will provide you both how to do brief comments, you know, offering your support for the role, or how to make more specific comments moving forward. And lastly, the Department of the Office of Child Care has provided some frequently asked questions on it, and we also wrote a blog that talks about the roles a little more in depth. So at this point, I'm going to open it up for some questions. It looks like we already have some good questions, but if you have anything, please feel free to send it, and I'll try to make sure we answer. There will be a recording of these slides online. If you go to usa.childcareaware.org, under Public Policy tab, you'll see a web policy webinar page, and under that, if you go to Lunch and Learn webinars, you can find it there. Both a recording of the webinar, if you want to share it, and the slides for the webinar will be there. This is a great question. Does this impact all families or only those who get CCDF funding? So things like the consumer statement will be provided only to parents receiving CCDF funding, but stuff like the consumer education website and the transparent system of quality indicators and the rationale for exempting providers from licensing is stuff that will benefit all children in child care in states that go forward with these. So in other words, just because a family may not be receiving funding through the Child Care and Development Block Grant Program, that doesn't mean they wouldn't be able to use the website and find more in-depth information about quality child care. Oh, this is another great question. How does this affect providers? So this is something that we've heard quite a bit about. You know, the consumer education piece will affect providers by just making sure they're being more transparent on their compliance with state and federal standards. So we'll see that providers are able to, you know, talk or be able to share what positive impacts they have. And in cases where it's not positive, they'll be able to have to be transparent and make public where they need to improve. And, you know, the goal of this is to make sure that all providers are providing a high-quality early learning experience for children in their care. So let's see what other questions we have. Oh, this is another great question. I think parents should be also able to see the positive for providers instead of just the negatives violations on a state website. Is this possible? So yes, you know, part of the thing you'll see with the website and with the transparent system of quality indicators and the consumer statement going to CCDF families is that they'll be able to see the compliance with health and safety standards, but they'll also be able to see which providers exceed those standards. So there's areas where, as I mentioned before, providers go above and beyond the call of what's required by state or federal law. I can give you an example in Virginia specifically. There's a center nearby that requires all of their teachers to have credentials beyond what the Virginia and federal requirements are. So a parent would be able to see that as part of the consumer education statement and possibly on the website, depending on the implementation on the website. Well, if there's any more questions, please feel free to send them through. Oh, this one more came in, which I think is extremely important. What day does the comment period end, and can anyone comment? The comment period ends on August 5th of 2013, so about 3 weeks away. So if you have comments, please make sure you go and make sure your voice gets heard by the Department of Health and Human Services. And, you know, the reason it is a public comment period is because they want to hear from the public. So please, anyone can go comment, so please do not hesitate. If you have questions about commenting, you can feel free to reach out to myself at the policy department. And before we finish this Lunch and Learn, I would like to make sure everybody's aware on this one that next week there will be no Lunch and Learn. We've had to cancel the Lunch and Learn on quality set-aside. But if you have any questions on the quality set-aside piece of the proposed rule, please feel free to forward those questions to me, and I'll be happy to answer them. At this point, I would like to thank you for your participation on this Lunch and Learn. If you have any questions, please feel free to reach out. Thank you.